Welcome, med geniuses. Welcome to another anatomy lecture series today. It's your great science tutor Lorenzo, and today we'll be talking about the anatomical snuff box. We have talked about the axilla, we have talked about the cubital fossa, we have talked about the carpal tunnel, so we are talking about the anatomical snuff box. So watch it in this area so that you will understand all I've been talking about, because these are important landmarks in the body that transmit neurovascular structures from different sections of the upper limb. So if you want me to make a new video for you, drop it down in the comment section. And if you have not subscribed, punch that subscribe button and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. It's always your great science tutor. Always follow me, always share my video to all medical students so that they will all follow up and you can discuss about it so that you can understand it. Make sure you teach somebody, because anytime you teach somebody, you tend to understand. So let us jump right into the video. Welcome guys to another space of the upper limb. We have talked about the axilla, we have talked about the cubital fossa, we have talked about the carpal tunnel. So we'll be moving to the next one, which is in the hand, the dorsum of the hand, which is the anatomical snuff box. So we are trying to talk about all the whole spaces of the upper limb. So in the next one, this one will be the anatomical snuff box, or you can call it the radial fossa. We have the carpal tunnel, which transfers neurovascular structures from the forearm to the hand. So this one is the radial fossa, or we call it the anatomical snuff box. It's called anatomical snuff box because that is where the depression, where they put snuff or tobacco, grounded tobacco, used for inhalation, which is a CNS stimulant. So when they ground tobacco, they put it there. Or those people that take cocaine, what happens when they put it there? They sniff it to that part of the hand because it's a depression. It's easier for content to stay inside the depression. So now, what is anatomical snuff box or the radial fossa? It's a triangular depression found on the lateral aspect of the dorsum of the hand. So you are seeing it on your screen now. It's a triangular depression found on the lateral aspect of the dorsum of the hand. It is located at the level of the carpal bones, and it is best seen when your thumb is extended. So if you extend your thumb now, do it now, you can see it on the screen. Extend your thumb backwards. When you extend your thumb backwards, you can see the anatomical snuff box will become prominent. So extend it now and you see the prominency of the anatomical snuff box. I told you it's called anatomical snuff box because the depression holds snuff. What is snuff? Grounded tobacco. They now, before inhaling through the nose, when they put it there, what happens? They take it in. Even people that take cocaine, you can, when you watch movies, you see they put it in the hand and they sniff it to check how good the cocaine is. Now, what are the boundaries of the anatomical snuff box? What are the boundaries of the anatomical snuff box? First of all, we have roof. What is present in the roof? Just like everybody: skin, superficial fascia, and deep fascia. Don't forget, skin, superficial fascia, and deep fascia. Now the next one is floor. What is present in the floor of the anatomical snuff box? You have the scaphoid and you have the trapezium. Don't forget, the scaphoid and the trapezium. Now we have the roof, we have the floor. Now we have what we call anterolateral. What is present in the anterolateral? You have the adductor pollicis longus and you have the extensor pollicis brevis, because the anatomical snuff box is present in the thumb, the dorsum part of the thumb, not the palmar part of the thumb, because the palmar part of the thumb is the thenar space or the thenar muscles that are there, but the one that is in the dorsal part of the thumb is the anatomical snuff box. So you have the tendons of the adductor pollicis longus and the extensor pollicis brevis located anterolaterally. Now posterior medially is the extensor pollicis longus. So now you have AEE. What is AEE? You have the adductor pollicis longus, you have the extensor pollicis brevis. The brevis muscle is a short muscle, so it is not attaching directly. It causes. The muscles is very short, so that's why I call brevis, while longus means the muscles are very long. Now in the posterior medially now, we have what the extensor pollicis longus. So we have discussed the roof, we have discussed the floor, we have to discuss anterolateral, and we have discussed posterior media. Now what are the contents of the anatomical snuff box? Now we have the radial artery, very important. Radial artery. The radial artery, some part of the radial nerve passes through the anatomical snuff box. The radial artery and some part of the radial nerve also causes the anatomical snuff box. Now superficially, what structures passes superficial to anatomical snowball, just deep to the skin, because inside the anatomical snowball you can see the radial arteries, and some branches of the radial nerve passes through there. But now superficial to the skin in the anatomical snowball, you can see the cephalic vein from medial to lateral side, and you can see terminal branches of the what superficial radial nerve from lateral to medial side. So it's different. From medial to lateral side is cephalic vein, while from lateral to medial side is the terminal branch of the superficial radial nerve, while inside the anatomical snowbox is the radial artery. Now, what is the clinical scenario of the anatomical snowbox? Don't forget the clinical scenario, because we did one for the carpal tunnel, which is the carpal tunnel syndrome. We did one for the cubital fossa, which is the taking of blood, IV injection to the medial cubital vein. You can also measure the blood pressure from the brachial artery, which is the brachial pulse also. And also during Volkmann ischemic fracture, what happens? You can also damage the content of the cubital fossa. But for this one now, the content of the anatomical snowbox, you can also feel the radial artery. So if you want to feel the radial pulse, you can also feel it in the anatomical snowbox, because there's pulsation of the radial artery at that point. Now there is a tenderness in the anatomical snowball indicates what fracture of the scaphoid bone. You can also have scaphoid fracture. So when you are putting your hand inside the anatomical snowball and you are feeling a tenderness or palpitation, what happens? It's indicating what scaphoid fracture. So also you can also give IV to the cephalic vein in the anatomical snowball. Same as the medial cubital vein, you can also give IV, or you can take blood from there. Same in the anatomical snowball, the cephalic vein is prominent there, and you can also give IV fluids there. Lastly, now the superficial branch of the radial nerve can be rolled over the tendons of the extensor pollicis longus. So you can roll it under the tendon of the flexor pollicis longus. So I hope it all made sense and you have understood everything I talked about in the anatomical snowbox, where we talked about that it is a triangular shaped space which is located around the lateral dorsum part of the hand. So if you check the back of your hand, we have the palmar side and we have the dorsal part. The lateral part, which is the lateral dorsal part of the hand, you can see the anatomical snowbox just around the thumb. So when you hyperextend your thumb, what happens? You can see your anatomical snowbox. So it's called the anatomical snowball because they put snuff there in the olden days to take it for inhalation. So we talked about the content, which is the radial artery, and what passes superficial under the skin of the anatomical snowball, the cephalic vein, and the terminal branch of the superficial radial nerve. Talked about the boundaries, which is the roof floor, anterolateral and posterior media. Now, if you are new to my channel, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. If you want me to make any video for you, make sure to drop it down in the comment section. When I go to it, I will surely make that video for you. Always keep listening and keep watching my videos and start sharing it to all your friends. Very important. I will see you in my next video. Bye bye.